While this podcast will cover information about how to access therapy and other mental health services, it is not intended to be a substitute for said services. This podcast is intended for educational and entertainment purposes only. If you feel you are in need of mental health assistance, please seek out licensed professional care in your area.
Not that type of therapy podcast.
Hello, dear listeners. Welcome back to Mental Health Quest, the therapist's office and beyond. This is Benjamin Times. I am one of your two co-hosts, and this is part 2 of our amazing discussion with Brittany and Hannah from Popcorn Psychology, all about child therapy and marriage and family therapy, and all the things that go along with that. So please enjoy part 2 of this conversation.
I was going to say, I'm just making this connection, hearing you two talk about like doing family work and working with kids again. Like I'm having flashbacks. And so I realized that I'm working a lot now. Unfortunately, like you had said earlier, a lot of the times, I'm sure even with couples, when you're working with kids or families or couples, trauma comes up. And trauma really, really affects family systems, how they relate to each other and everything like that. I say, that I work with trauma with people. I don't necessarily have specific trauma training, but since I started my career, like I was talking about in the residence, I have been dealing with trauma. And I think it's really funny to hear you all talking about the family systems and how they work and seeing how they interact and things like that. And I think having seen that for so long, that's what helps me help adults who have childhood trauma, because they don't understand what enmeshment looks like, or if there was abuse that went on or neglect or whatever, like they take responsibility for the things that, I should have done that, or if I would have just been better at this, then my parents would have accepted me more or whatever. And it's like, no, like I know that for a fact. Like I worked with families for probably 7 out of the 15 years I've been in the field. That's not how it goes. You were a kid. You were supposed to be taken care of. This was supposed to be your role. You are not the diplomat. You shouldn't have been doing those things. So I just put it together now, like working with adults that have childhood trauma that I'm helping them process. Like you're doing it in the real time, right? I'm helping them go back in time and be like, no, you were a kid. This is the way it should have worked. It's just not how your family worked at the time. It's just really interesting. I was, I use all that information when I'm working with trauma.
And I mean, in my experience and our continued experience, especially on the podcast, is it goes back to trauma. It goes back to trauma for so many people in so many different ways. And that just happens to be that's something that has the biggest impact on how we relate to other people, how we relate to the world. So it makes a lot of sense.
And I would imagine with like couples too, like if you're getting into a relationship with somebody, right? We always talk about our baggage, right? Like a lot of the time people don't realize that baggage is trauma. And then you bring it into the relationship and you act it out on each other. And it's like, poop.
Yeah. And I do imago therapy with people. And so a part of imago therapy really comes back and says that you find the person who can heal the things that you need to heal. But the problem with that is that they also push all of your buttons. And so we really have to work to grow together instead of growing apart. And that's really what I talk about. And that all goes back to trauma, because most of the time it's one or both people are responding to the situations they grew up in, because that's the situation we all were in for most of our life. So of course it's going to have an impact on us in some kind of way. And so and I've worked with couples who've been together for 15 years. I've worked with couples who've been together for 2 years. I've worked with couples some of the hardest couples I saw was when I was doing my internship and I was shadowing somebody else who was a couples therapist, and really saw some like stonewalling, looking at each other, not touching each other, not even really acknowledging the other person's existence almost. And so again, like you really need that piece as a family or couple therapist. We really, seeing how the other people react to each other is just a really big part of that.
Well, it's so interesting for me. Like I said, I've not done a lot. I've not done couples work. I've dealt with couple stuff in my recent job with people on parole because, okay, they need like special, like if they want to be able to see their families, I need to talk to the family to kind of see, does the family understand what's going on? But I wasn't doing couples work. That was more like psychoeducational. But it's so interesting with regards to trauma. I mean, I know it's like a cliche to say that everything comes from childhood, but it does. Because how else do we learn how to be humans if not from our childhood, from observing our parents or other caregivers and other people around us? And what a lot of people don't understand is it's not like parenting is something you turn on and off. It's not
As
like,
a
okay,
parent?
well, when I'm doing this, I'm parenting. But if the child observes me doing this, that's not parenting. No, the child is
all
observing
the
everything.
time, 24/7.
And so and I've noticed this come up a lot when I was working with my forensic clients. These are people that have had adverse childhood experiences and have now also committed crimes. And it's so interesting because when talking about healthy relationships, that is like our number one thing is how do we have healthy relationships? Because that's a big protective factor against crime, is having healthy relationships. Their understanding of what a relationship should, and I put emphasis on the word should, is because I don't like the word should, because they have these ideas. It should be this, and so I'm going to do that, or that's the way I saw it, so I'm going to do it. And it's like, okay, and clearly that's not working for you. And understanding where the trauma of witnessing these things, of experiencing it as a child comes in, it's so uniquely difficult for people to recognize. Like people know, oh yeah, I had a shitty childhood or whatever, but to see how that experience is informing the way you make decisions about everything. The childhood trauma or the family trauma is influencing how this individual is going to relate to every human being in the world, whether they're in a romantic relationship, business relationship, platonic. And so it's so interesting to see that. And so, I guess if you are a therapist who was able to work with the families in that moment and be able to like get them through that, that's amazing, because every other therapist is just like, okay, well, all I can do is help you to understand and explain the stuff. The trauma does not excuse, it does not excuse nothing. And I told that to my forensic clients because they're like, well, I committed the crime because I was victimized. Like, that's not an excuse. It's an explanation. But now we need to understand, if this is explaining how we're behaving, then how do we behave differently? And so it's so interesting.
Yeah, I bet it is. I think the only other thing that I wanted to say before we move on, and also Brittany works with families, has probably worked with more families than I have, because surprise, surprise, it's really hard to get families into session. Almost impossible sometimes, or even couples for that matter. But one thing that I'm glad that you said, Ben, is that you refused to work with couples when you didn't have training. And I think a lot of the reason why people have shitty experiences with couples therapy is because they're working with somebody who has absolutely no training, and somebody who is just saying that they'll work with couples. And that is such a dangerous place to be, because couples can be. I've had couples who've wanted me to come to their divorce, and I'm like, they're not going to get anything from me that's going to be helpful. It's all hearsay at this point. That's literally I'm not going to have anything to contribute. But when I tell people, and again, nothing against, I know that there's people who have LCSWs. I know there's people who have done couples for a long time and have a lot of training. But when I tell people to look for a couples therapist, I say, make sure that they have an LMFT or have at least gone to school and been trained as a marriage and family therapist, because it is different.
It is very different. I mean, even with psychologists, because I mean, my grad school, at least, I can't speak to every psychologist's grad school experience, but I didn't that anything. I only know about these things just from being in the field, just from existing and working in the hospitals and working in the clinics and everything like that. And so I feel like for especially for couples and for family and children, you want to work with someone who has training in that, because these are very, I don't want to use the word volatile, but volatile in the sense of like chemistry. You're working with things that have the potential to explode. Couples and families and working with children, these are very delicate work. And if you as a therapist do not have the right amount of training in it, and I get it, the only way you get training is a lot of times by doing, but you need to have the right supervision, you need to have the right environment to learn as you go, that you're not being thrown into the deep end and saying, okay, well, you have to learn to do couples, so here, let's start with the most, explosive couple ever. Like, that's not a good way to get training, because not only is that just turning you as a therapist off to this whole population, that's potentially harmful to the couple and to the family system and to the kids and everything. When I was doing that early training, my supervisor did not do a lot of couples work. So she was like, I am not able to train you properly to do the couples work, so we're not going to do the couples work. I do have a lot of training with children and adolescents and in that aspect of the family system. So I will train you in that. And so I saw a lot of children and adolescents, particularly as it related to family related issues, because that was the training that I was receiving, and the supervisor was able to supervise appropriately for that. And so for anybody out there who is listening, who is looking to become a therapist, whether it's LMFT, LCSW, LCPC, psychologists, any letter of the alphabet combination now.
Yeah, all the letters.
We have alphabet soup now. Really, I want you to think about, if you want to work with the population, you need to have the right training, and you need a specific type of supervisor. It's not just, oh, well, they can supervise me because they're licensed. Legally, sure. Legally, that's covering your ass. But like, ethically, that's not enough. If your supervisor does not have the training in this population, and they are agreeing to supervise your work with the population they're not trained in, that's just a whole bunch of mess. So future therapists out there, seek out the training, seek out the supervision. There are supervisors that want to train you in these things. They do exist. You just have to seek them out.
And also advocate for shadowing. Like, I didn't take a single family therapy class in grad school because I didn't have to, and I was paying for school out of pocket. So if I didn't have to pay for that class, I wasn't paying for that class. Like, that's just the real situations a lot of therapists are in, right? And so, but I worked in partial hospital programs, like right away. That was my practicum. That was my internship. That was my first 2 jobs, my 4th job. Like, that's been the bread and butter of what I've done for the most part. But I shadowed people. Like, I sat in on a lot of family therapy sessions, and I've had interns and students sit in on mine. So if you don't have that opportunity in school, and it ends up being something that you want to do or that you learn about in your internships and stuff, like, you can advocate for sitting in on sessions. And all that looks like is the therapist in question just has to vet their caseload, see what couples or families would be appropriate to ask that for, usually people you have a good rapport with, and then just have them sign a release. It can feel weird, and like, it's part of the learning process, and it can feel weird for you as the therapist because it feels like someone's like, well, obviously someone is observing you do your work, so you feel like you're like on the spotlight, but it's helpful. And then you can debrief with the student or intern afterwards of like, what did you notice? What came up for you while we were doing that work? Like, do you have any questions for me? So it's also good to give space after those shadowing experiences to let them pick your brain about the choices that you made or didn't make during that session. I
wholeheartedly agree, because I feel like that just goes into seeking out the proper training. Shadowing is something that, I did it in the hospitals. I could shadow the other social workers in the hospital, but it was not something that I had a lot of opportunity to do in the clinic that I was at. But the place that I was working with forensic, it was all shadow. That was how you started working there, was shadowing. Like it was by law, because I was working with sex offenders. And so in order to get certification by the state of California to work with sex offenders, I had to have a certain number of hours of observation where literally I was not legally allowed to speak for the entire, I don't even remember how many hours. And so I would sit in on all the groups and all the individual sessions that I could. You talk to the therapist, you talk to the psychologist and say, I would like to shadow. I would like to sit in on your group. I would like to sit in on your sessions. And they will say, okay, yeah, how about this one? This one is a good one to start off with. And they will then talk to their clients and explain it to them. It's like, hey, this is how therapists learn. And so this is what's going to happen. And the client is okay with it. Then you sit in the corner, you zip it and you watch everything. Mm-hmm. And I was very fortunate to have that in my most recent job with the sex offenders, because I mean, all populations, you need to have specialized training, but forensic work is so complex that I'm glad that they forced me to have that extra observation time. And the clinic I was at was also really good at all your groups were co-facilitated. And more often than not, you had at least one of your groups with your supervisor. So I always had somebody that I could talk to debrief, that I can observe how they are interacting with the group. And then also to see my supervisor, to sit in with the supervisor and see them at work in the group. That's something I never had before. I learned so much. And as a therapist, as a trainee, that's how you develop your skills. That's how you decide, okay, I want to work with this population. So, but especially with children and families, if you can get that shadowing, go for it.
Mm-hmm. Yeah, honestly, I don't know how controversial this opinion is, but anecdotally, this is what I have discerned, is I don't know if people's whole practicum and internship should be at private practices. I think that you should because you don't have to stay at the same place at least in my experience, your whole practicum or internship. So I just happened to go to a partial hospital program and like it, and that's what I continue to do. But I think it's good to figure out varied settings and figure out what settings fit your vibe as a therapist. And also in those bigger partial hospital programs or agencies, you have more opportunities for what you're talking about, Ben, which is there are rounds, there are meetings where you talk about cases. There's a lot of therapists. You can kind of weave in and out of sessions and programs and groups, and it's not super noticeable because there's a lot of people working there. And you just have a lot of opportunities to see a variety of clients, a variety of intensities, of also mental health symptoms. I think why I'm saying this might be kind of controversial is, to be quite honest, the people that I work with who I can tell they've only done private practice, even if they've been in the field for a long time, they have a lot of blind spots, both ethically, I think even just from their own perspective, they just have intense cases scare them. They have, to be quite frank, and people can cancel me for this, I guess, they're a bit more snobby. My experience has been, maybe that's more in Chicago, but is that they don't know what it's like for someone to be schizophrenic and be living on the street. Those jobs, those community support jobs are really stressful. So I honestly don't think everyone needs to do that to be a good clinician.
Yeah.
It's good experience, and I think it gives you a lot of perspective. It helps you with, I think, the family systems, or just even systemic concepts of how people get to the places they're at, why it's ethically good, in my opinion, to take the hit and take Medicaid clients if your practice accommodates for that. Not all practices can. But I think it gives you a more, worldly perspective that I think is really important to ethically do our work as clinicians, and I think what I'm saying is people I've worked with who happen to have only done private practice work, they're a bit more sheltered, or a lot more sheltered. And that will show even when we have the same years of experience. And so I feel grateful that I just happened to, like, I literally opened up a binder to figure out where my practicum would be to make my choice and just kind of like put my finger down in it. And it happened to be this experience that I think has done me like priceless amount of good going into, because I only just started doing private practice primarily 2 years ago. So 8 years into my career.
I worked in the psych hospitals for 5 years, and then my practicum was in a residential setting. So yeah, those kinds of environments do allow for a lot of shadowing. And I think you know what, I agree with you, Brittany. Practicum and internship, or at least like maybe, I don't know how internship differs for you guys, but for me, internship is split between pre-doctoral and postdoctoral. And so I think that like pre-doctoral should be an agency because you're still learning, you're still in school, and you need to get that experience in the shadowing. And then postdoctoral, you can start doing the private stuff a little bit more because you've had that experience. And you had that kind of environment. And same thing, practicum. I just can't even imagine how to do practicum in a private practice. My brain does not compute that, because like for our listeners to understand, practicum is your very first clinical experience. You've literally never dealt with a client before, ever. And my brain just can't understand, how do you have somebody who's not this, like you're maybe like, at least for doctorate, that's like you're halfway done with your doctorate. Like I mean, I'm not even close for graduating yet, and I'm doing this. Like, how do you have someone like that seeing a private practice client? Like my brain just does not compute that, because to me, and I was lucky that I had that experience in the residential, I could, have that support of the team. So I am agreeing with you there. If anyone wants to add us, they can, they can.
I mean, I could argue this all day.
They can fill out a complaint form on nice tissue paper and throw it in the suggestion box.
Yeah. Yeah.
Well, even as a private practice business owner, I realized too, I took on an intern because they specifically wanted to do the D&D groups that I was doing because it was different. And, obviously, like, there's not a lot of places that are doing that. But I said the same thing. I was like, do not try and stay here all 4 years of your master's, or all, however many years you're going to do your master's. Go out and go to an agency, go to different places, because you are not getting the full experience here. This is not where I started off, and there, like you said, there are so many good things that you learn in those agencies because of the team atmosphere. Like, I worked with some of the best child psychiatrists in the state because I worked at an agency. Like, so I know, I obviously am not a doctor, but like a medical doctor, but I know what they would have said in this instance. They would have said this, You know what I mean? It's invaluable sometimes. Those years are very hard. They're very busy. They're very intense, but you do earn a whole heck of a lot when you're working for an agency, community agency.
I did my internship out of private practice, but I got clients who couldn't pay anything, or clients so I got, and also probably weren't screened as good as they probably should have been, as well. But so I was still getting a little bit of that experience, but then my first job, because nobody will friggin' hire you when you get out of grad school, my first job was working for Thresholds. And even though, it ruined my life for a while. It was an invaluable experience to have, to not only understand the systems that are in place that are keeping people in the places that they're at, but also to help understand how to navigate it, and how you really can't navigate it unless you lie about some stuff, because that's the only way that those systems work. And so, but even just like, again, having a better understanding of the breadth the breadth of how different someone with bipolar disorder looks as compared to somebody who mostly experiences bipolar depression versus having manic episodes every once in a while that are kind of consistent. And even so, just like understanding and also getting a chance to work with a lot of psychiatrists. And also, I think the most important thing was learning how to advocate for my clients with the psychiatrist and helping them understand you are allowed to ask more questions. You are allowed to ask what this is doing. You should understand what your meds are doing, why you have to take them, and should be able to talk about that instead of getting, run over by a psychiatrist who's like, you're the 100th person I've seen today, so whatever, I don't care. I'm just going to write it in your thing, and I'm not even going to ask you any questions about how you're feeling.
Even now, I say to my clients, look, if you're going to work with a psychiatrist, that's great. Most of the time they have a quirk. So be ready for it, whatever it is. But number two, a lot of the times they're so smart that they won't slow down and explain things to you unless you stop them and ask. Because they are doing it every day, all day, and saying the same things over and over again. They won't stop and explain, why are we upping this? Why are we doing this one instead? And I say that to my clients all the time. This is like, make them stop and explain it to you. Most of them will, but if they don't, if they have a problem with explaining it to you, then we might want to go see somebody else anyway.
Yeah, I feel like I do a lot of coaching with clients about their psychiatrist appointments, and I'll say, you can ask this question. You can ask this question. I want you to, this is something that you should consider because this is something we've been seeing. What about this? What about this? You're allowed to go into the room with a list of questions about what in the fuck is going on and why you're getting medicated for things that you may or may not need. And again, I'm not a medical doctor, but I sat in 1,000 psych appointments and learned about what the medications did and what medications helped and what medications different. And people are always so surprised. They feel so intimidated by psychiatrists as well.
Well, I think, and I feel like this episode has turned into just, how to be a therapist, I guess. We'll figure out a cool title for it in post-production. But, there's, especially with psychiatrists, there's that whole authority figure kind of intimidation. And it is unfortunate that a lot of psychiatrists play off of that. They're like, well, you got to do what I say because I'm a psychiatrist.
Well, they're the last buck in a lot of things. I've worked in these more treatment team settings, and the psychiatrist is the king, really. All roads will lead to their approval in a lot of ways, even though they sometimes are the ones seeing the patient the very least, and by a big margin.
Absolutely. When and I've seen that in the two different hospitals that I worked at, in the acute unit, the psychiatrists were there maybe 5 minutes, or they would have their nurse practitioners or physician assistants go instead. But in the long-term unit that I worked at, I was very lucky that the psychiatrists there, they would spend time with the patients. They would spend time with all of the staff. The psychiatrist would, come in, they would sit with all the patients, would take time to talk to them, whoever they had scheduled for that day, and any patient who just wanted to randomly talk to them. And then they would sit down with all the nurses and sit down with all the recreation therapists, sit down with me as a social worker. That it's good when you have a psychiatrist who is willing to listen to another perspective, because like I said, everybody's seeing things from a different perspective. Every clinician has their own way of seeing things. And maybe I saw something the psychiatrist didn't see, or maybe the psychiatrist or this other therapist, when I was working with the family, this stuff, they saw things that I didn't see, because obviously I'm seeing things only from when I'm working with the adolescent of the family system. And the kid's not going to tell me, all the stuff about the parents' interaction with each other, unless it's something that he witnessed. It's really good, I think, to kind of try to wrap this up into something related to the initial topic of children and families and couples. It's really good to consult with other clinicians, whether they are directly involved in the case, especially if they are. if you know that your client, the family that you're seeing, that are seeing someone individually, get releases, talk to that other person and consult, because especially with children and couples and family systems, you need to have that kind of like support, and that you can bounce these things off like, hey, I'm noticing this. Are you noticing that? Okay, maybe that's something that we need to address further or investigate. They are going to see things that you don't see, and vice versa. And when it comes to children and families and couples, I think that is vitally important to be able to consult with somebody. And if you don't have somebody that is seeing the child, still consult. Talk to another expert in child therapy or in couples therapy. Consultations are like, it's basically the kind of supervision that you're not getting any hours of supervision for, but you're still learning something. And, that's just bettering your abilities as a therapist.
Sometimes even just being able to talk a case out loud can help you get, like when I talk about a case, either in consult group, because I run the consult group in my private practice that I work at, or like even just with fellow therapists, like friends that are also fellow therapists. Obviously, we don't use names and we protect confidentiality, but sometimes just talking a case out loud is all I need. Even if I don't get feedback from my colleague, I'll be like, oh, now that I'm saying this all out loud, I'm realizing that this is something that I'm doing, or this is something that's coming up in session a lot, and maybe I can try this instead. So yeah, you're right. Just like, I think also why I don't love private practice for people's entire practicum internships is that there isn't a lot of room for that. A lot of private practice is happening in a vacuum. And I think the reason why I enjoy private practice so much at this stage in my career is I've done so much fucking consultation. I've done so many rounds, and I've talked ad nauseum about so many cases that I like not having to talk about stuff unless I want to talk about it. And I like being in my little hobbit hole and choosing to come out of it every once in a while. But I know that like with newer clinicians, that's what I like about it is like what I think is a strength at this time in my career feels like a weakness or a limitation with greener clinicians I work with in the same setting, because you do want a lot of support and you want a lot of information, and private practices really can't necessarily deliver that if they're smaller, or if
you just don't have it built in,
if you're just very new to the field, just because it's not the nature of private practices. And I kind of almost wish they were more discussed as like a place you'll get to eventually if you want to, but that it's more like a stepping stone setting than like where you start and where you stay and where you end.
Well, I think we covered a lot of things, both related to our initial topic and not, but this is the great thing about this podcast is, yes, we had our initial topic and we did cover that. And I greatly appreciate hearing your guys' experience of working with children and couples and how that is different than the traditional individual, because I only primarily did the traditional individual stuff. But I hope our listeners would appreciate this, hearing all these perspectives of what it's like to be a therapist and what is involved in being a therapist. This whole podcast is we're not only educating people about therapy and about mental health, but also what is it like for us as a therapist? Because if you're going to go to see a therapist, this is what we're going through. And, I'm lucky that I understand this as a therapist, because now when I go to my own therapy, I understand what they're going through.
Yeah.
And, if anything, for me, it helps me to be a lot more open with them. At some point down the line, when I finally graduate and get my license, and maybe I will be supervising, and I can have this ability then to appreciate the supervisee a lot more. Or maybe I'll be providing therapy for someone who is a student and stuff like that. Like I can be able to give them that I have now. So I appreciate listening to both of your guys' experiences. Is there any last minute things that you would like to say about working with children and couples and families for people that might be looking into those kind of things?
Well, I know I didn't talk too much about the family part of it. So I can just say a few things. One is family therapy is very, very different in different settings. So I'm still kind of figuring out what family therapy looks like in the private practice setting, because when you do in like the more intensive settings that I've been in, it's a part of the program, and it's a part of what you're talking about, Ben, of like all that collaboration. Like I've been the individual therapist within a treatment team like that. I've been the family therapist within a treatment team like that. And it's kind of like a given. And because those kids that I worked with were having really intense things going on, like either behaviorally or like substance use sometimes, or just like really intense stuff going on where the kid is the identified patient. Maybe I'll put it like that. That kind of family therapy is very different than outpatient. And I think what I'm still figuring out is how to give kids autonomy within the family therapy space in the private practice work. Because like I said, in these intensive settings, you kind of have to do it. And there's a lot of like intense stuff happening where it has to happen. Like you just had a suicide attempt. We have to do safety planning. There isn't a negotiation. You have to come to these sessions. Like we are prioritizing bigger things than whether you want to be here or not. And in outpatient private practice, I've actually worked with families that came from my last job, which was a PHP, and they know me because maybe I worked with them there or I worked with one of their other kids. And so I've had to do some reconfiguring in even that space of like, it's not going to look like what it looked like there, where I can feel like I'm siding more with the parents to address the kid. And in this space, like I'm learning that my style is that I'm not interested in making kids submissive and obedient or like their parents. And so I think a lot of times too, kind of going back to what you were saying a while back, Hannah, is I'm very clear with parents, especially if I'm getting this whiff from like the intake, like setting up the appointment, is if like the parent wants to have a relationship with the kid who's not a big fan of them right now. And when I meet with that one-on-one session with the teenager or the kid, like I'm very real with them, and I prep the parent for this too. Of if they're not interested in doing this work, if they're not genuinely interested in doing family therapy with you, I'm not going to make them. If there's not a safety concern happening, or you know what I mean, and the kid's just not into it, and they're fine. Maybe they're in their own therapy, they're doing well in school, whatever. They just don't want to go to your house on Wednesdays, like the court order says they're supposed to. I'm not going to pressure them into doing this work because you're having a hard time as the parent sitting with the fact that your kid just doesn't want to have a relationship with you. Where I will give the parents the benefit of the doubt in those situations, or just give them more slack, is a lot of people think that's what family therapy is, right? That our relationship's not working. We go to a family therapist, I do some bibbity bobbity boo work, and their kid and them get along. And kind of what you said, Hannah, before is when you're doing family therapy, is the family is my client, and everyone has to be interested in the client, the relationship. And so if I'm working with a teenager and they're like even if they're just wishy-washy, I will sometimes say, we're not doing it yet, or we're not doing it now. I'm assessing out, because I'm not going to talk your kid into having a relationship with you. I think it feels icky in the sense of like, I'm being maybe coercive towards the kid, or pressuring the kid to have a relationship with you, or to at least identify why they don't want to have one with you. It just feels, I never like it in that space where it feels like it's a bunch of adults staring at a kid, trying to get them in line in some capacity. So a lot of times more, if the kid's not interested, I will tell the parent, I'm happy to still work with you in a parent coaching capacity to like address kind of like what's working, maybe not what's not working, and how you're approaching your kid, and walk you through that in addition to maybe individual therapy you're doing. But I'm not going to sit here once a week or once every other week and to like convince your kid to hang out with you, or to like you, or to get over things they're not ready to get over yet. You want them to like your new girlfriend? That's not my problem. They're allowed to not like your new girlfriend and maybe be a bitch about it. Like, that's not something that needs to be solved in therapy. And I think that is really hard for parents to hear. And sometimes they don't agree with me. And then I say, well, then I'm not the therapist for you, because I'm not going to do that work. And I've assessed out a lot of families, specifically with teenagers, who come in with that perspective. Like, I really have to assess with them, like, what is everyone's goal with this work? And parents are really shocked that I give their kid that level of say or power within this dynamic. And they always say they can always come back. If something changes in the future, I tell the kid this too. If something changes in the future and you do want to work on this relationship with your mom or your dad or whoever, like, I'm happy to help you. And kind of what you were saying, Hannah, before, I'm always, as working with a kid therapist, you have to always be thinking big picture. And I've worked with kids where they kind of liked me. Our sessions were sort of okay, but half the time their parents were literally dragging them into my office. And I told their parent, like, they do need a therapist right now. I'm not going to debate that with you. And they aren't feeling it. And I'm not trying to ruin therapy for them at 9, because they're going to need it when they're 13 and when they're 21 and when they're 32. and I already see that for them. And I'm not going to have therapy be a place where they were literally picked up and dragged into a therapist office, and then I'm like in their face for an hour. And so same with family therapy is I tell parents, like, I'm not going to make it be this weird therapy, this weird space where their parents got to weaponize therapy to make them listen and see them and talk to them. And I have to work with parents about, like, you need to work on whatever's coming up for you about the fact that your kid right now does not want the relationship with you that you want to have with them. And that's individual therapy, and that has nothing to do with your kid, ironically. And so that's what I want to add to the family therapy thing. I think also when you're greener, there's this idea that every case that comes to you have to take and you have to make work. And I get that when you need a caseload, you need that money. Like, I get trying to make every case work that comes your way. And these cases will drive you berserk because you will either feel like you're bullying the kid. It'll just feel bad. Something about it will just feel bad, and you're going to be banging your head against a wall, and it's not going to feel good, and you'll probably end up in the same place you're going to end up anyway. So just, like, save yourself the hassle. And like I said, respect the kid's autonomy, you know? And I also try to tell parents, kids are more likely to want to have a relationship with you later if you give them space now to not be a big fan of you, to not want to be around you, to maybe tell you to fuck off and not have a relationship with you for the next 3 years. But you still call them every once in a while. You still show up when you're supposed to show up. It's not about you. And if your kid's having a feeling towards you, even if it's earned or not, get over it.
Because it's honestly developmentally appropriate at that time.
Yeah. And if your kid, this happens a lot when I work with divorced families. Like, if your kid is not feeling you right now, and maybe they're pissed that you're dating or that you're engaged or whatever, and they'd rather be at home at their mom's house where their bedroom is, that feels like their bedroom, get over it. Get over it. It's not about you, and you'll have more, in my opinion, prognostically, a better relationship with them later if you pump the brakes now. But people really struggle with their sadness around that and their ego too. And sometimes they can't see the forest for the trees. So sometimes me also assessing them out, my hope is that's kind of not a rock bottom, but just kind of like I'm making a real big point to them, like that this, like, I'm not going to work with you like this. And can that be the mess? Can they finally get that message? Because I'm being very firm about that. But they also might, I don't know, turn around and go see another family therapist who's like, sure, I'll work with you.
Yeah, I don't know if I have anything to add. I think just letting people know that while doing family work and couple work is challenging, it's also very interesting, and I learn a lot. I learn a lot with couples. I learn a lot with families, and I learn a lot from my individual clients. I mean, I own my own private practice, and I mostly see individuals. And so also, even though, and that's what I tell people ask, like, what's the difference of working with you versus somebody else? And it kind of goes back to that. I look at the big picture, I look at the environment, I look at all these other pieces. And also, I think it's really, I guess the only thing that I'll say to people, especially to people who are going to school maybe to become a therapist, is get your own fucking therapist. I will never be a therapist without a therapist, because I need it. Because I have a lot of stuff. And also because I need to have confidential conversations about what is coming up for me when I'm working with my clients. And sometimes it's a little bit of consultation. Sometimes it's a little bit of I'm being triggered by this client and I know why, but I can't figure out how to help with that. I can't figure out how to separate out things for myself. So just get a therapist. You're not better than therapy. And let me tell you, it helps immensely with client relations if you are somebody who has also been on the other side of a therapy experience.
Absolutely. I mean, this, first of all, it's for new therapists when you're in training. I don't know if it is for you guys, but for me, it was required for me while I'm in school and before I get my license, it is required for me to be in therapy.
It was not required. And it was something that was very controversial at the time. I went to school in 2011. It was very controversial at the time of like, oh, and we would talk about it in ethics class of like, oh, but what if you're forcing people to go and they're not ready and blah, blah, blah. And it's like, that shit doesn't fucking matter. You need to know what it's like to be on the other side of a therapy experience. You just need to fucking know.
And you just need to be able to have that space where you can talk about what's coming up for you, because surprise, there's going to be things coming up for you as a therapist when you're talking to your clients, because that's just the nature of the beast. So, I mean,
and your supervisor is not your therapist. And I think that's a good thing to put out there. Your supervisor will help you be a professional, but they're not there to work you through your shit.
Yeah, but and some people think of supervision as like, oh, wow, it's therapy that I get paid to go to, basically, because it's like part of the job. No, supervision is professional development. It is helping you to recognize what you need to work on to be a better therapist, but they're not going to sit and do the work with you on that. My supervisors were like, oh, wow, okay, this is coming up. That's for you to talk about with your therapist and let me know. Because obviously, if this is coming up, they need to be able to manage your cases and everything. But I'm glad that I was forced to because it helped me tremendously. And, you know, I'm surprised that that's not required for other therapists. I don't know if that's just a California thing or all psychologists have to do this for their doctorate programs, but I definitely did.
We did group therapy. We had a class that was group therapy, and we did group therapy on each other. Hardcore. It got really deep. But you could opt out of that class and write a paper or something, which I thought was whack. Like, I was like, why is there... I mean, you could opt out of even just like twice a week, 3-hour class. It was like Tuesday, Thursday evenings.
You couldn't opt out of it. Everybody had to take the group class at my school.
But you didn't have to do that even. And I thought that was weak sauce. When I did that, I was like, if you can't even do this amount of therapy, like where it's not even individual, it's like you're in a group and you're also practicing being a therapist in that space too, because you're therapizing each other. And I thought that was really effective too.
Yeah. I mean, that's always good to be able to have the opportunity to practice and everything. And, you know, that's how you learn. So, again, thank you both, Hannah and Brittany, so much for joining us. I feel like we're probably going to have another episode of just about like, you know, being a therapist. What is it like, you know, the behind the scenes look of a therapist or something? Because this was like that was basically what we did. But now I kind of am having an idea of like, we're going to get all different kinds of therapists together for one big episode of like the behind the scenes look of what it's like being a therapist. Because I don't know about you guys, but like, whenever people find out that I'm a therapist, I get that question like, well, what is it like to be a therapist? And like, what is it that you like, what is a day-to-day like? And it's obviously it's very different for every therapist, but I just recently had the opportunity to go to my high school to talk to students about like majoring in psychology and what is different careers. And so they're asking, well, what is like day-to-day life of a psychologist? And like, there's 4 of us in the panel, and like, well, very different experiences. It's like, there's no one answer to that question. Like, I do this. Like, so I think that would be a great episode. We would absolutely love to have you both back on. You can bring my doppelganger Ben with you.
Yeah, thanks.
My variant. I can't believe I haven't yet met him, but you know I will, and it'll be great. So to close us off, where can people find you on the interwebses?
Sure. So, like Hannah mentioned at the top of the episode, we are both co-hosts with our Ben, Popcorn Psychology. So he's a LCPC as well. So all three of us are licensed therapists who actively practice in Chicago. Every episode, we pick a movie. Like one of our recent episodes was The Shining. Another one we did Addams Family, which Benjamin, you were on. And then Charlene, you were on our episode on The Mummy. And so if you liked hearing us talk about all this stuff, like we have over 100 episodes on that podcast. And you can find us at Popcorn Psychology on Facebook, Twitter / it's Facebook, TikTok, and Instagram at Popcorn Psychology. On Twitter /X, it's popcorn_psych. And you can always email us at popcornpsychology@gmail.com with any questions. Like, for instance, like the sheet that Hannah referenced that we sometimes give out to people who are like therapists in training. And yeah, you can find us at Spotify, Apple Podcasts, any big podcast. I think anywhere you find podcasts, you can find Popcorn Psychology. And we have a wealth of a back catalog if you want to check us out.
Awesome. Thank you. Charlene, where can people find you?
You can find me all over the internet at all the places. Current and past, X, Face, whatever Twitter is now, at Nat20Therapy. You have at Nat20Therapy on Facebook and Instagram mostly right now. Also, I have a website, www.nat20therapy.com, and my email, if you have any questions, is info@nat20therapy.com.
Well, for our listeners, I do have another podcast of my own. It's called My Hero Therapy, where myself and my co-host, Dr. Nicole Hassler, talk about mental health and the My Hero Academia anime.
All right, well, that's it for this time. I will see y'all later. Bye!